Have you ever wondered why colon cancer is often referred to as the silent killer? This ominous nickname is not without reason. Colon cancer, much like its moniker suggests, often progresses quietly, showing little to no symptoms until it reaches advanced stages. This silent progression is what makes it a formidable foe, one that demands our attention and vigilance. The importance of early detection cannot be overstated. It is the difference between a fight and a surrender, between hope and despair. Early detection means the disease can be treated more effectively. It means that the odds are in our favor, but to detect it early, we need to understand it. We need to know what to look for, the telltale signs that something might be amiss. Let's take a moment to consider the scale of the issue. Every year, colon cancer affects more than 1 million people worldwide. Not only that, but it's also one of the leading causes of cancer-related deaths. These figures are not meant to instill fear, but to emphasize the importance of awareness and early detection. Now you might be wondering, if colon cancer is so silent, how can we possibly detect it early? The answer lies in vigilance and routine screenings. Regular checkups and tests, such as colonoscopies, are our best defense against this silent threat. They allow us to catch the disease in its early stages, even before symptoms start to show. But it's not just about screenings. It's also about listening to our bodies, understanding the subtle changes that might indicate something is wrong. Even the silent killer leaves traces, warning signs that we can pick up on if we know what to look for. In the end, the key to winning this battle lies in our understanding and early detection of the warning signs. It's about being proactive, taking control, and not letting this silent threat dictate our lives. The power to change the narrative is in our hands, and it starts with awareness. So, what are these early warning signs that we need to be aware of? Well, the first sign we'll talk about is changes in bowel habits. This could mean anything from constipation to diarrhea, or a change in the consistency of your stool that lasts longer than 4 weeks. You might also notice a feeling that your bowel doesn't completely empty. It's important to note that while these changes can be symptoms of other health issues, a persistent change in your bowel habits could be a sign of colon cancer. The second sign is blood in your stool or rectal bleeding. This is a symptom that should never be ignored. Blood in the stool may make it look black and tarry. Sometimes the blood can be so slight that it's not visible to the naked eye and is only detectable through a fecal occult blood test. If you notice any of these signs, don't hesitate to bring it up with your doctor. Next, we have persistent abdominal discomfort. This could be cramps, gas, or pain that seem to stick around longer than usual. It could also include a feeling of fullness or bloating that doesn't go away. While everyone experiences stomach aches from time to time, discomfort that doesn't go away might be a signal that something more serious is going on. The fourth warning sign is weakness and fatigue. This isn't the normal tiredness that comes after a long day or a poor night's sleep. This is a constant feeling of being tired even after getting plenty of rest. This fatigue can be caused by anemia, a condition that can develop if colon cancer causes internal bleeding, leading to a decrease in the number of red blood cells. The final sign is unexplained weight loss. If you're losing weight without trying, especially if you're also experiencing any of the other symptoms we've discussed, it could be a sign of colon cancer. This weight loss can occur because cancer cells use up a lot of the body's energy, or because they release substances into the body that change the way food is converted to energy. In summary, the warning signs of colon cancer include changes in bowel habits, blood in stool, persistent abdominal discomfort, weakness and fatigue, and unexplained weight loss. If you experience any of these symptoms, it's important to seek medical attention. Don't brush these signs off as nothing serious. Your body is trying to tell you something, and it's crucial to listen. Remember, having one or more of these symptoms doesn't necessarily mean you have colon cancer, but it is crucial to consult with your healthcare provider if you experience any of these signs. Let's dig a little deeper into some of these symptoms, shall we? First off, let's talk about the persistent change in your bowel habits. This could mean diarrhea, constipation, or a change in the consistency of your stool. These changes happen because a tumor in the colon can slow down the transit of stool, causing constipation. Alternatively, it can also lead to a partial blockage in the colon, which can result in diarrhea. Next, we have rectal bleeding or blood in your stool. This is quite self-explanatory, isn't it? A malignant growth in your colon can cause bleeding. However, not all blood is visible to the naked eye. Sometimes it's only detectable through laboratory testing of the stool, which is why regular screenings are crucial. Now let's discuss persistent abdominal discomfort such as cramps, gas, or pain. A tumor can cause a blockage in the colon leading to these symptoms. It is important to note that while these symptoms can be caused by other, less serious conditions, persistent discomfort should not be ignored. Then there's a feeling that your bowel doesn't empty completely. This sensation can occur when a tumor within the colon prevents the full evacuation of the bowel. It's a feeling that despite having a bowel movement, something is still not quite right. Unexplained weight loss is also a symptom to watch out for. It happens when cancer cells use up your body's energy supply, or when a tumor blocks the colon, making it difficult for nutrients to be absorbed. Finally, we have fatigue and weakness. These symptoms occur because colon cancer can cause a slow, chronic loss of blood, leading to anemia, which in turn results in fatigue. Now that we have a better understanding of these symptoms, it's time to look at what we can do about them. Experiencing these symptoms can be scary, but what should you do if you notice them? The answer is simple yet crucial. Don't delay. Immediate action can make all the difference. The importance of early consultation cannot be overstated. If you or your loved ones experience any of the symptoms we've discussed, it's imperative to consult with a healthcare professional. This could be your family doctor, a gastroenterologist, or any medical practitioner who can guide you through the necessary steps. Remember, these symptoms might not necessarily mean you have colon cancer, but it's always better to be safe than sorry. Regular screenings are another critical component in the fight against colon cancer. The American Cancer Society recommends that people at average risk of colon cancer start regular screenings at age 45. These screenings can take various forms, from a simple stool test to a more comprehensive colonoscopy. Regular screenings can help detect any abnormalities early, giving you the best chance of successful treatment. Maintaining a healthy lifestyle is another way to reduce your risk. A balanced diet, rich in fruits, vegetables, and whole grains, can contribute to good colon health. Physical activity is also beneficial. Try to incorporate at least 30 minutes of moderate intensity exercise into your daily routine. And remember, it's never too late to quit smoking or limit alcohol consumption. It's also important to listen to your body. If something feels off, it probably is. Don't ignore persistent symptoms or write them off as mere inconveniences. Your body is your best advocate, so pay attention to its signals. Lastly, encourage your loved ones to be aware of these symptoms and take action if they notice anything unusual. Share the knowledge. Because the more people are aware, the more lives can potentially be saved. It's important to remember that early detection is our best defense against colon cancer. So, if you notice any of the symptoms we've discussed, don't hesitate. Consult with a healthcare professional, get screened regularly, maintain a healthy lifestyle, and listen to your body. Every step you take brings us closer to a world without colon cancer. Before we wrap up, let's summarize what we've learned today. We've delved into the silent threat of colon cancer, a disease that often creeps in unnoticed. We've spoken about the early warning signs, including changes in bowel habits, blood in the stool, persistent abdominal discomfort, unexplained weight loss, and fatigue. Remember, these symptoms don't necessarily mean you have colon cancer, but they're signs you should not ignore. The importance of early detection cannot be stressed enough. It's the difference between a battle and a war, between a scare and a threat. If you experience any of these signs, it's crucial to consult with a healthcare provider. Don't hesitate, don't second guess. Your health is too important, so let's keep these warning signs in mind and take proactive steps towards our health. Remember, the power to prevent colon cancer lies in your hands. Let's not give the silent killer a chance.